County's weekly COVID-19 public health briefing for May 8, 2020. Today, we continue to be hopeful for less positive cases of coronavirus to impact our county's citizenry. We mourn those precious lives lost to this communicable disease, and we continue to gain more questions than answers on a daily basis. We ask for your help in stopping the spread by staying home, shopping solo, and always masking up when it is necessary to leave your home. We are proud to support our essential workers by following these guidelines as provided through our public health department, and we stay home and apart for our loved ones, for them. Thank you.
Good afternoon. My name is Lynn Johnson. I'm chairman at Orleans County Legislature. Our number one priority is to help protect the community, patients and employees of Orleans County. Now more than ever, it is imperative that we remain diligent in our social distancing habits and continue to wear a mask when in public. In regards to the disturbing amount of positive COVID-19 cases and deaths at the Villages of Orleans nursing home, the New York State Department of Homeland Security shipped 307 test kits to Orleans County yesterday, specifically for the nursing homes, after our outcry for the state to intervene and investigate this terrible situation. Orleans County is also requesting that New York State add a mobile testing site here so that our residents do not have to drive 45 minutes to get tested. I ask all of our residents to stay safe and to stay informed. Thank you. At this time, I introduce Paul Pettit, our Public Health Director, to give his daily update.
Okay, good afternoon, everybody. Thank you, Chairman Johnson and Chairman Stein, for your opening remarks. It's a pleasure to have you speak directly to the residents and share what's on your heart and mind as we continue to deal with COVID-19 here locally in Genesee and Orleans County. As I get started, I just want to take a quick minute to recognize our nurses. Many of you know this is Nurses Week. Nurses Day, I think, technically was on Wednesday. But you know, we give them a whole week to try to honor and recognize the great work that they do. You know, personally, I have many nurses that work for us in the health department. I have two nurses in my family directly, and we all know what great effort and great dedication and sacrifice it is to be a nurse. And you know, we've all needed some level of medical care. We've all needed to engage in the health system at some level. And we've all had great interactions and the ability to have good relationships and good interactions with nurses. And you know, we know that they're working very hard right now, along with a lot of the other healthcare workers. But particularly when we you know, are recognizing this week, I personally just want to say thank you to all the nurses in Genesee and Orleans County for putting yourself in harm's way, for going above and beyond during the COVID-19 response, and you know, doing the swabbing, taking care of those that are ill. I mean, it's an extremely important job and something that we all owe you all a debt of gratitude and thanks. And I truly appreciate you guys working on the front lines for us. You know, and no matter if it's during the pandemic or just normal day-to-day work, we appreciate you and we thank you for your service. All right, so I'm going to continue on with our normal Friday afternoon activities, including going through some of our data and talking through some of the changes and different information that we've been dealing with this week related to COVID-19. So as of 2 p.m., Genesee County has received one new positive COVID-19 case for a total of 162 positive cases. The positive case resides in Batavia, excuse me, and the case is in their 80s. The newly positive individual was not on quarantine prior to becoming symptomatic. And one of the previous positive cases has recovered and has been released from mandatory isolation. 5 of the total active cases are hospitalized. So again, one new positive case today in Genesee County. Orleans County has received 0, repeat 0, new positive COVID-19 cases for a total of 124. So again, 124 total cases, 0 new being reported today as of 2 p.m. 2 of the previous positive community cases have recovered and have been released from mandatory isolation. 7 of the total active positive cases are hospitalized. And today we are reporting that an individual under the age of 65 who lived in the villages of Orleans has passed away. Due to privacy issues, we're not going to be releasing any further information on this, but again, as we continue to report out any death in our community is a tragedy, and my sincerest condolences to the family and friends of this individual as they go through this time and grieve the loss of their loved one. So again, cumulative data, looking as we go through, Genesee County is a total of 162 cases. We have had 1,179 negative tests. We have 16 folks under isolation. We have 53 under quarantine. We also have 3 deaths and 91 now recovered. In Orleans County, we have 124 positives. We've done 736 COVID-19 tests. 15 are under isolation, 35 under quarantine, 18 total deaths, and 40 recovered in the community. One thing I just wanted to explain real quick on our charts again, as we've been doing over the past several weeks, we continue to tweak these and play with them a little bit, hopefully to provide additional clarity in what we're trying to report. And again, some of this is based on feedback, and just as we go along, it's a good opportunity again to refine our process and to make sure we're being as transparent as we can and make sure that folks are able to hopefully understand the information that we're putting out. So one of the things we changed before, as you know, is we took out regulated facilities out of our cumulative numbers around isolation, quarantine, and quarantines. We added in community. So there was some confusion around there. We want to make sure it was very clear that what we're reporting on as far as isolations and those in community quarantine are the folks in our community. They're not in the regulated facilities. So again, just a little more clarity to hopefully get folks a little more aligned and better understanding what we're reporting out. Again, we do have our online mapping tool, which is available, and we hope that that is something that is useful for folks, and they're able to click on that and see this on a daily basis. As a reminder, it's updated every day throughout the week, except on the weekends. Again, we want to make sure that any new data that comes in over the weekend is as accurate as can be. So we will be reporting out just raw numbers and deaths over the weekend, but the mapping tool will be updated again on Monday to catch up with anything that has happened over the weekend. So again, we have our age breakdowns and our facility breakdowns that are available. Again, I'm not going to go through those in detail. They're there for your reading pleasure. But again, a reminder on the facility breakdown, these are only showing the facilities in our counties that have current active cases that we've received reports on. So if they're not listed there, another facility you may be aware of, that is why there's no currently reported cases. If and when we do get cases in those facilities, we will be adding those to the list. So that'll be cumulative and running total as we move forward. Just another reminder, as we've been talking about, the health department does not have regulatory authority over these independent regulated public facilities. It's typically done by the State Department of Health, or in the federal sense, the federal government. So again, we have very limited oversight and ability to do much in these facilities beyond report the numbers and work with them when they do have cases to again try to isolate and minimize the impact of spread within those facilities. All right, so a couple things just to report, some changes, some things that have been occurring in the counties over the past week since last Friday. There's been a lot of talk and discussion around antibody testing, COVID-19 serology testing, and availability in our community. And as we reported last week, it is still not readily available. We believe Well Now, Urgent Care in Batavia is the only community-based source that we are aware of. Again, there could be others that is doing serology testing and looking for antibodies. So again, I know folks are able to call and make appointments down there if they want to potentially get their antibodies done. But beyond that, it's very limited in our communities. This again continues to be a great frustration for all of us, not only with the antibody testing now, but again, access to the COVID-19 test itself. We've been reporting this since day one. We just do not have the access. We do not have the capacity that we need to be, I think, effective and sufficient in our testing capabilities. As Chairman Johnson mentioned, we have sent a letter to Albany formally from elected officials, and I signed on to that myself as the public health director, requesting that we have specifically in Orleans County an option for folks to be able to go get tested for COVID-19. Fortunately, in Genesee, we do have UMMC and Penn City, again, Well Now Urgent Care, and some other places are doing testing in Genesee County. So there is a little bit of more additional access to those folks, but in Orleans specifically, we don't really have anything besides private providers if they're doing the swabbing to swab our folks. Again, regionally, you look in Monroe County and Erie County, there is access, there is ability for folks to go get swabbed. So we do know that a lot of our residents are traveling to have this done. But again, we don't think that's appropriate and or needed. We need additional capacity here locally so that our folks don't have to travel. They can get the testing done in their neighborhoods. And again, that is going to be key for us moving forward to understand the prevalence of COVID-19 here in Genesee and Orleans County. A little bit of numbers I had pulled out for today on the antibody testing, just so folks can get a better understanding. Again, I think there's been a lot of talk and a lot of chatter that people have felt they've had COVID-19 already. Maybe back in December, January, February, they were sick. They may have gotten a flu test and it came back negative. So, there's a lot of folks that believe that they've been exposed to COVID already. So this is where the antibody testing comes into play. And just so people can get an understanding of where we're at, again, these are very limited, small numbers just due to availability. But in Orleans County, as of 2 o'clock, 44 county residents have been tested, serology tests for antibodies, and 4 out of 44 have come back positive. In Genesee County, there have been 336 antibody tests, and 11 have returned back positive. So between the two counties, we're under 400 total tests, and we only have 15 confirmed positive for any level of antibodies for COVID-19. So what this really tells us, is that it may not be as widespread as far as previous exposure to COVID-19 as some people may think it has been in our community. Again, based on the onset from New York City and then across the state, I think it does make sense that we have not had a large number of folks in our communities exposed yet. As we're well aware, folks did a great job of social distancing, closing things down, schools closing down right when this was all starting to move in our direction. And as a result of that, I believe we've done a good job in flattening the curve. We've talked about that. But also now on the flip side, as folks get the antibody testing done, I think it's becoming more evident that again, the exposure and people thinking that they may have had it is not necessarily coming to fruition. Again, the numbers are small. We want to see a lot more testing. We want folks who believe they may have been exposed to get tested. But again, early numbers and indications show that that's not necessarily the case in our communities here. One thing also just to note on antibody testing, again, it takes 2 to 3 weeks potentially after an infection to potentially build up the antibodies. So again, most folks who feel they've been exposed 2, 3, 4 months ago, they would potentially have those antibodies. But if you potentially just were sick last week, even if you had the antibody test, it may not show up yet. So again, just some nuances of the testing. But again, we're trying to get more of this available. We want to get a better picture and understanding of what's going on in our communities. It'll help paint the picture for us as we continue to move forward in trying to reopen things and get our communities back up and running. Another thing that's unknown with antibody testing that we've been hearing about is a lot of folks, and this is not atypical with a lot of different diseases. Once you have it, if you have antibodies, you're typically protected and you may not get it again. With COVID, again, it's too early. There's a lot of data out there that is showing that you potentially could be reinfected. Again, we are hearing different mutations of the virus that even if you've been exposed to this one, if it does mutate, you could be exposed to mutated strains in the future. So there's still a lot we don't know about this. We're learning day by day about the virus itself and how it impacts us. But again, just want to provide a little additional data for folks to get a better understanding of what's going on here locally in our communities. All right, a couple more things. As we talked about with Easter about a month and a half ago, we have Mother's Day coming up this weekend. And again, this is a special holiday, a special opportunity for us to celebrate our mothers, our grandmothers, different special folks in our life that we want to take some time and recognize their impact on us and the role that they play in our daily lives. And it's very difficult because I know for a fact that, personally speaking, this is usually an opportunity where we get together in big gatherings with family. We have cookouts, we have barbecues, we have different dinners, we go out to eat and celebrate, right? And this is unfortunately another one of those situations where we're not in a position and we're really discouraging that from occurring. Same thing with Easter. This is a time where we still need to be very cognizant and intentional about maintaining social distancing. And we're asking folks to do their best to adhere to that this weekend. And, again, use other means. Try to engage with your loved ones in a different way via social media, via distance talking, so to speak, instead of going in and having these big gatherings. So, again, we want to keep our moms safe and moms healthy. So let's do our best to protect them this weekend as we try to celebrate and recognize the importance they play in our lives and do it safely. And hopefully we won't see many, instances of increased cases and increased activity as a result of potential gatherings this weekend. All right, so real quickly on unpausing. So as we continue to move forward, we're getting close to this magic date that the governor talked about a month and a half ago, and then he moved it, and now we're a week away potentially from unpausing. We've been talking about it. I'm sure you're seeing a lot of this on the news around what this means. And as we talked about last week, we are part of the Finger Lakes region. So Genesee and Orleans, based on the economic development zone, we are lumped in with the Finger Lakes region around Monroe County. And essentially our ability to move forward is going to be tethered to the rest of the counties in our region. So it's very important that as we move forward, just like with what I talked about with Mother's Day, this is the time we have to be vigilant. We have to continue to adhere to the social distancing requirements. We have to continue to wear masks, stay 6 feet apart from folks. We have to be very intentional here. What we do know is that our ability to move forward and unpause, it could be hindered and slowed down if we unfortunately start to see increased cases, increased hospitalizations, and a lot of additional activity in our region. And that is not what I want. I know that's not what you want. And we want to be able to move forward and start to peel back some of these regulations and restrictions as we move forward. So it's very important, again, that even though we may not want to, as the weather gets better and we start to feel like we want to get out and start to engage socially a little bit more, we need to do it in a very smart and social way, and one that helps protect others as we move forward. One thing you may have been seeing some information on is how this plan is laid out to work. And again, things are very fluid with the state right now. We've talked about it many times that the communication and the information that we get here locally is unfortunately not real time. The governor continues to share information on his daily updates and briefings, and the guidance documents come out 2, 3, 4 days later. So it unfortunately puts us in a very reactionary mode typically. And we are doing our best to understand, to comprehend, and to apply what that means to us locally here so that we're all doing things as appropriately as we can to make sure we're all being safe and healthy. One thing that I just wanted to talk about real quick around the phases is we know there's 4 different phases. There has been a little bit of, I think, discussion and just unsure how this is supposed to be applied. From our current understanding, again, potentially due to change, but each phase is 28 days. So when you talk about a 4-phase plan, essentially what's going to happen is the governor is proposing to unpause, potentially starting May 15th, into phase 1. In phase 1, we're looking at different businesses like construction, manufacturing, wholesale supply chains, select retail establishments using curbside pickup only. Again, that list is fairly broad here. It's not very well descriptive, and I know there's many folks out there that have been reaching out to us asking, do we fit in phase 1? Do we fit in phase 2? And the reality is we don't have a good answer for you. I know that's not what a lot of folks want to hear, but we are essentially dependent upon the state of New York and the Empire State Development Corporation to define what is essential, what's not essential, and what fits into these different categories. And we are committed to getting you that information as soon as we know. So again, going back to the phase process, we're talking 28 days here. So 2 weeks for phase 1, and then there's a 2-week assessment period. So as we talked about from the beginning, COVID-19 has a 14-day incubation period. So what has to happen is we have to unpause. We have to see in the incubation or the testing period, is there going to be an increase in cases? Is there a rise? Is there activity going on, which will give us some information into whether we should be able to move to phase 2. All right, so again, we're talking 4 weeks in between phases. Phase 2 currently covers professional services, financial and insurance and retail, administrative support, real estate, and rental leasing. So again, very broad categories. Again, 4 weeks later, if we continue to meet our metrics, we move to phase 3, restaurant and food service, hotels and accommodations. Again, another 4 weeks, we move to phase 4, which covers arts, entertainment, recreation, and education. So again, broad categories. This is potentially due to change. This is what we know now based on the governor's blueprint for unpausing and reopening our regions. I think my main point here is just that folks understand this is not going to be May 15th, everything's back to normal, everything's open, we're just back the way it was pre-COVID days. Unfortunately, it's going to be a slow walk. The governor's been very clear that he intends to do this very intentionally, very strategically, and slowly, and based on the data, which is why I can't say it enough. We're all in this together. We have to be compliant. We have to wear the mask. We have to maintain our social distancing. We don't want the data to go up. The data is not going to lie. It's going to show what's going on in our communities. And unfortunately, as a region, if we see increases, it's going to potentially hinder us in our ability to move forward. So again, we'll keep talking about these phases. We'll talk about the timelines as we know if and when changes come to that. We will make sure to articulate that and share that widely with our 2 communities here. Another thing that was just released out of Monroe County, and this is a regional tool that we just want to talk about real quick here, is the ROC COVID-19 health screening tool. It was talked about on a lot of Rochester media outlets yesterday and this morning. And this is a new system that has been developed, and Common Ground, the organization out of the Finger Lakes, they're going to be the ones manning and overseeing this tool. But essentially, this is another opportunity for us to gather data around what's going on in our region related to COVID-19. And essentially, it's a real easy system where folks can, I believe they're building a texting component to it, but right now you hop on to the website, you can sign up and you send an email in. You're basically reporting daily any potential COVID-19 type symptoms, and that goes into a database, and it's aggregate data. So what comes out of that is by zip code, and it potentially can show us and identify hotspots around potential COVID activity within our 9-county region for the Finger Lakes. And it'll give us data to potentially be able to go in, set up testing sites, set up and go in and do different interventions to try to aggressively contain any type of flare-ups as we move forward. So again, the website is there for folks who want to participate with that. It is live now. So we are going to continue to push this out in our daily briefing, but if folks are interested in participating, we'd encourage you to go on, and the more data we can get into this, the better picture it's going to show potentially of what's going on locally in our community. So more to come on that. Also, you may have been seeing some advertisements around contact tracers. The governor has talked specifically about developing a contact tracer army, or a big fleet of tracers that are going to be available to help county health departments around the state respond to COVID-19 activities moving forward. So there is some information, again, that will be posted that's available if people are looking to potentially be part of this effort and this initiative. There's an application. They're going to be starting to hire folks very soon. And, it is an opportunity to be employed and to, be part of the COVID-19 response activities. So again, feel free to click on that and apply if you are interested. In addition, we've been sharing the nursing home hotline number that is available, again, for any type of complaints and concerns around nursing homes, specifically here in Genesee and Orleans County. Feel free to, again, call that number, click on the link to lodge any complaints and concerns. Again, going back to prepping for reopening, we talked a little bit around unpausing, but one thing we we have available now, we worked to put together a guidance document within the health department, and it's on our website. There's a link here that, again, you can click on that would allow folks to download this document. This is a guide that we want to put together to help businesses, to help not-for-profits, to help any type of establishment, faith-based organizations, whatever type of business or organization you're part of. The governor's been very clear as we move through the different phases, you need to be ready with a plan. There's still not a lot of great guidance around what that exactly means as far as be ready with a plan. There's no expectation or any type of mandate that there has to be a plan that has to be reviewed, approved, et cetera at this point. We'll again provide information if and when that comes, but for now, we want folks to be proactive. We want you to start looking at your different organization. Every place is different. Every place has different logistics and ways that consumers or participants or worshipers, whatever it may be, interact within your facility. But what we do know is we have to maintain the social distancing. We have to maintain the different requirements that are out there around keeping folks safe during this time. It may include, again, the distances at checkouts, or making sure you're removing seating, reducing capacity, having masks available. We know many different establishments have gone to mandating masks, that folks can't even come into the stores or the facilities without having some type of mask or face covering on. So again, it's all over the place with exactly what different folks are planning to do, and again, it has to be custom tailored to what fits in your organization. But this guidance document that we put out there will hopefully be helpful. It's not the end all. You don't have to follow it to a T. It's just meant to be a guidance document and helpful as you prepare and get ready to unpause and reopen. All right, so again, we've talked about antibody testing, but again, and swabbing itself, still not readily available in our communities. If folks need and they're symptomatic, they can't get it through their healthcare provider. At this point, we're encouraging you to travel and participate in one of the sites that is available, either typically here in Genesee County in the Batavia area, or travel to the sites in Monroe or Erie. And again, we're pushing for some additional capacity. We'll see how that goes. As I start to wrap up here, again, just typical reminders that I do around mental health. Again, we understand that this is a very difficult time. It can be trying. It can cause anxiety, depression, other types of behavioral health and mental health issues for folks. We want to make sure everybody knows that there is help. There is assistance for anybody that's feeling down, feeling depressed, needs to talk to somebody. So make sure you take the opportunity, if you're feeling that way, to talk to somebody. We do have our mental health departments in both counties. We have different independent and private organizations in both counties. And we also have our care and crisis helpline 24/7. So make sure you reach out, you touch base, and you're not alone. You're not abnormal. You're not weird. If you're feeling this way, it's definitely very understandable and something that we have resources that are available for you during this time. Also, we have some information on there for domestic violence. We've also heard many reports around the state around increased domestic violence occurring during this time, with folks spending more time at home and being confined in different spaces. So again, if you're dealing with that or you need to make reports, again, the number is available here along with a link to make reports. So we encourage you to utilize that as needed. All right, so with that, I'm going to turn it over. We're going to open it up to the media for questions. Again, if you have any questions, make sure you please state your name and your affiliation, and we'll be unmuting you guys here in a second so you guys can ask questions.
Jay, I want you to, if that face masks are mandatory or not, if you could clarify.
Oh, okay. So quick clarification before we pause. Face masks and face coverings are required when you're out in public if you cannot maintain your 6-foot separation. That's really what the guidance and the governor's directive is right now. It's not necessarily mandated at all times, wherever you are, but he was very clear that if you're out in the community, if you're going into facilities and into stores, and you cannot maintain your 6-foot separation distances, you do have to have a face covering on. So it is not a mandate 100% of the time. It is something that, again, we are strongly encouraging from an exposure and public health standpoint to make sure you have one with you, and that if you're around folks within, again, that 6-foot separation, that you are wearing and you have some level of a face covering on. Again, there are some different guidance for stores, facilities, where if you're interacting with the public, you have to wear a face shield. So again, if you're part of a retail establishment, or as we unpause and you may become one of the establishments that can open, you do and you are required under the executive orders to wear a face mask when interacting with the public. But again, within the private business or organization itself, again, if you can't maintain those 6-foot separations, those are the scenarios where you do have to have a face covering on. And as we said many times, again, there is a place in through the New York State on pause if there are complaints and concerns that folks may have around bigger gatherings that are allowed right now, if there's businesses that are not adhering to the requirements, businesses that may be open and they're not supposed to be open. Again, the formal process for that is to go to that New York on pause site. You can click on the link. There's also a phone number that you can call and lodge a complaint. Essentially, that goes into the state, it gets logged in the system, and then it gets pushed back down to the locals for law enforcement or the appropriate agency to respond, to go out and figure out what's going on, hopefully get the establishment or the group, the people, et cetera, back to the place where they should be. So again, there is venues and places for folks to lodge complaints and concerns if you're seeing those in the community. Okay, so we'll turn it over now to anybody from the press that has any specific questions. We'll do our best to answer them.
Okay, Paul, it's Tom Rivers with the Orleans Hub. You know, I wondered with the 307 test for the nursing home, I wonder why that number. I don't know if that was a specific number you requested or if someone requested.
Yeah, so essentially what happened here with the number on that is we did work with the nursing home facilities in the county, the long-term care facilities, and essentially they put together a line list. So they identified the number of residents in their census and also number of staff. So this is not just residents. The state wants to come in and test residents and staff in all of our regulated long-term care facilities in the county. So obviously 307 is a bit of an odd number, but that happened to be the total of the line list that was submitted to the state.
Okay, and I suppose people would wonder about the dementia wing, if anyone has tested positive there. I don't know if you know.
Again, we can't speak to specifics of inside the villages itself. We're going to have to refer you back to the villages administration and or the State Department of Health to speak on specific questions in regards to inside the facility.
Well, if I could just ask you one more that you probably can't answer. I wonder if anyone has recovered in the villages that have had the virus.
Well, again, we don't track them specifically inside the facilities. Again, going back to the conversations around our data, I will say that anecdotally speaking, as you guys are well aware, we follow a 7-day, 3-day fever-free for folks to get recovered once they've tested positive in the community side. So following that same standard and metric based on time frames, it would be safe to assume we've had folks recover within the villages and within other facilities that we do not track, again, these regulated facilities. So again, based on our clearance criteria that we use, again, we don't have a specific number for you within, but based on that time frame, I would say yes, there have been folks that have officially recovered within the villages.
Okay, thank you.
Yep.
Hey, Paul, it's Howard Owens with the Batavian.
Howard, how are you?
Good. So I got just probably two questions. The first one is looking at the age chart for Genesee County. We see a lot of 20s and 30s, 40s. The numbers seem higher percentage-wise than what we see elsewhere or statewide. Just curious about your explanation. Is that due to, say, the detention center or what we've seen of essential workers, and that maybe is disproportionately affecting that age group?
Yeah, I think you hit it on your last comment there. Obviously we've talked specifically about the detention center, and as we know, a lot of the folks that are in there are kind of in that 20, 30, 30s category, 40s category. So again, that drove a lot of our numbers with almost 50 cases in there. And again, I think if you look at community spread, some of the other little clusters we've had in the community, it's again amongst more of a working age group per se. And then obviously that flips a little bit over when you get up to Orleans County when we've had the issues in the nursing home where you see, again, the higher numbers in more of our 60s, 70s, and 80s categories.
My next question may sound a little bit above your pay grade, but considering your knowledge of the phased opening process and the numbers that go with that, I'm just curious, your speculation, your prediction as to whether we're going to see any Batavia Muck Dogs baseball this season.
Yeah, outside of my pay grade, the reality is, it's hard to say. Again, with any of these different activities, looking at, as I described, the different phases that the governor has laid out. And again, we do not have any control over this. This is dictated down to us from Albany. Recreation activities, those type of things are in phase 4. Again, hopefully due to change, but with that in mind, as I kind of laid out the time frame going from phase 1, 2, 3 to 4, that puts us sometime in August potentially if we continue to progress consistently throughout the phases. So, I'm an eternal optimist. I'd like to say yes, we will be watching baseball, not just here in Batavia, but around the country and locally too. But it's a little hard to say how that's going to play out. And again, if it is allowed to open anywhere, it's going to have to be done with social distancing and these different strategies in place. And again, it's up to these organizations to figure out how they're going to do that safely and meet those requirements.
Thank you, Paul.
Paul, it's Tom Rivers again. Would you consider playgrounds to be phase 4 with recreation?
Well, Tom, that's a good question. I mean, it's all in the interpretation. I guess I would like to personally see them opened up before that if we can. I guess from my perspective, the more folks can identify different ways to open safely, hopefully the governor's office will have some discretion and allow us to move forward and maybe have some local discretion into what things fit certain categories. Again, I think, potentially with these different playgrounds in our village parks and different areas, again, if there's a plan, if it's laid out, if it's talked through in a very safe and strategic way, I do believe there's ways that we can move forward with opening some of those up. Again, hopefully before the middle of August.
With those contact tracers, would they work for you? Or would they be state employees, do you think?
So it's actually a contract through the Michael Bloomberg philanthropic company, organization, whatever his non-for-profit is. PCG, which is a company that runs actually one of our early intervention program software systems in the state. They've been the ones that have been identified and tasked with overseeing the hiring and the overseeing of hiring this contact tracing army. So they will not be county employees. They will not be state employees. They'll be hired through this company, and they will be tasked and loaned out and assisting different local health departments as needs arise. Our understanding is these folks will be trained. They'll be certified and be ready to go, and they'll be really used more as a surge capacity in different counties, different regions, if and as hotspots occur. So locally here, how that would play out is if all of a sudden we were seeing significant increases in Orleans or Genesee County, and it was beyond the capacity of our local health department staff to do the effective tracing and putting folks under isolation and quarantine orders, we would reach out to this system. We would notify them that we're having some capacity issues, and again, they would send folks out. They would be embedded with us, but they would not be our employees, but they would be reporting and working alongside our health department staff.
Do you need people right now, to, I guess, help with the surge?
So that's a good question. Right now I've reported to the state a couple times on the level of our local contact tracing capacity in both counties. And again, with a shared service arrangement between our health departments, we have 23 that are currently trained and doing some level of contact tracing at the moment, but we also have up to the 30 level, again, trying to hit that 30 per 100,000 that we've identified that can assist us as needed. And based on the number of cases that we're seeing, these 2s or 3s or 4s per day, my staff are currently in a position where they're handling those numbers readily and without too much trouble internally. So unless we start to see significant spikes as we unpause, or we start to see more complex cases, again, as we unpause, if people are not practicing social distancing and masking, and the case contact and the close contacts of these positive cases become more widespread, and they become more complex in doing the contact tracing, we're in pretty good shape right now.
Okay.
Hello, Paul.
Yeah.
I'm Tharp, WBTA News, and I'm also on the board for several summer camps that are across New York State. And I was wondering where a summer camp would fall under that. Would that be a recreational as far as you know?
Yeah, summer camps, this is another one where I'd love to have a good answer for everybody, just like campgrounds and, all these other activities throughout the summer here. It's very hard. We've been pushing back to the State Department of Health, to the governor's office on a daily basis that we need clarity, we need direction. Obviously with summer camps, families have to plan on those. They build vacations around them. There's different, again, levels of need of these camps. And at the moment, there has not been any clear direction on if and when and how summer camps are going to be able to move forward. The governor's office keeps telling us that they expect to have a decision on those things soon. But I'm not able to give you any clear, definitive answer of where those will fall into phases, if and when, and how the governor will move forward and when he'll let us know on that. He has been very clear that he will make a decision, and it's going to be a statewide decision. He's not going to allow potentially summer camps to be open in one county and not in another. So again, stay tuned. We will get that information out to you as soon as we know.
In other words, a special case. All right, thank you.
But Paul, in general, that's what we've been told consistently by the state, is that the state itself is looking at and making those decisions and is not delegating anything to local county health departments, correct?
That is correct. It's been made very clear to us. We've been getting calls about a lot of different topics, including potential graduations and other, community events and people wanting to, host different carnival festivals and parades and different activities. And, the reality is, unfortunately, we're not in a position to be able to review, approve, condone, endorse any type of these activities, unfortunately. The governor has made it very clear that he is in charge, or his administration is in charge of making the policy, making the guidance, and basically allowing things to open and or not open. So unfortunately, we're not in a position to do anything different than that. I mean, we do advocate, we do push, we do whatever we can to try to make sure we're in a position to offer as much and as best as we can, again, in a safe and strategic way to our community. But ultimately, that decision does not lie locally.
This is Howard again from the Batavian. If Shelley wants to take a question, Shelley, are you available to take a question?
I can try, Howard.
Okay, I just want more of a political question. When you look at, it seems like the county's done pretty well flattening the curve and minimizing the impact here, even though we did have some high numbers at a couple of points. Been doing very well recently. So much pressure on the county. Is there any feeling on your part, frustration, anything that makes you want to move ahead faster with getting things going again?
Howard, thanks for that question. Here's what I know is that if we get to a point where it is safe enough to open a couple of our industry partners, and then everything that we've worked to gain just becomes out of control, then we start all over again. And that would be worse than what we are doing right now. There's absolutely no doubt about the fact that there is incredible frustration on every business level, whether it be large business, small business, mom and pop shop. People are tired. People are grieving their lives. And so the worst thing that we can do right now from a very practical position is to just discard all of the good practices that we have put into place and move forward too fast. And unfortunately, I think that that is the reality that we are all living under today. So thank you for that. I appreciate it.
Take care, Shelley.
Thanks.
Paul, if I could just ask one last question. I did want to wish Shelley a happy Mother's Day, and Lynn. But, with all the agricultural workers coming from out of state and out of country, is there some kind of quarantine that they do when they arrive, for a week or 2 or 2 weeks or whatever?
Yeah, it depends again on what country they're coming from. And again, most of the places where these folks are coming in from, they're not necessarily under those mandatory quarantine countries. We do know that some farms are quarantining their folks when they come in for a 2-week period out of precaution. It's not something that we are necessarily mandating and requiring, but I don't think it's a bad practice to do that. We've been very engaged with the agricultural and the growers in both of our counties for several weeks, going on months now, around helping them to get prepared for their workers. We know that obviously we have a lot of dairy farms who have year-round help and year-round workers, but more, the seasonal end with folks coming in for the planting season and, throughout the summer into the fall for the harvest. We know with this population, we need to, have good dialogue and make sure that we're, again, trying to push the most recent guidance and hopefully, language that can be readily understood and available. We're working hard with emergency management and Cornell Cooperative and other agencies to make sure the growers have access to masks and hand sanitizer and the different information that they may need, again, to make sure that their full-time staff and also their seasonal farm workers are safe and protected. We're also working with the growers specifically on, potential plans around if there are positive cases within the camps, how do we safely isolate and quarantine folks and make sure that we're protecting everybody's health during those times. So again, a lot of dialogue has been ongoing in the background, and we continue to work with the growers. We have great collaboration and good working relationships. And, so far there's been, a great willingness on the part of the growers to make sure that they're adhering to the guidelines and doing everything they can to protect their workforce.
Okay, thank you.
Any other questions? All right. Well, again, I'd like to thank everybody for tuning in for our Friday afternoon briefing. As I mentioned earlier, again, happy Nurses Week to all of our nurses in our communities. Thanks again for all that you do. And happy Mother's Day to all of our ladies out there in our lives. So with that, be safe, be healthy, keep your distances, and wear your face coverings. Thank you.
Thanks, Paul. Thanks, County Health.
Thank you.